Good afternoon. Today is Wednesday, April 22nd. I am joined today by Dr. Janae Caldoun, our Chief Medical Executive, Dr. Marissa Eisenberg, Associate Professor of Epidemiology, Complex Systems, and Math in the School of Public Health at the University of Michigan, and Dr. Emily Toth Martin, also Associate Professor in Epidemiology at the University of Michigan. I want to start by thanking those of you who have tuned into these press conferences every couple of days in order to get the facts and stay attuned to what is happening in our state and what we are thinking and sharing information with you. It is crucial to stay informed during this time, and I am so proud that we live in a state where so many people are choosing to do that and taking the precautions that we know are contributing to the flattening of the curve and saving lives. On that note, I want to thank the members of the press who have been reporting on this pandemic for over 6 weeks now. It is a relentless job, and it is absolutely critical to keeping people informed. I've held more than a dozen press conferences on this issue alone. I've issued more than 50 executive orders to protect people from the virus. This is truly an unprecedented time, and I am glad that there are talented, dedicated reporters in Michigan to make sure that Michiganders get the information that they need. Today's update on our cases, we have 33,966 positive cases. That is up 999 since yesterday. Sadly, we have lost 2,813 Michiganders to COVID-19. That is up 113 since yesterday. Like I've said at the last couple of press conferences, these numbers are hard to look at and hard to take, but what they represent is really a sign for cautious optimism. They show that the vast majority of people in our state are doing their part. They show that social distancing is working and that Michiganders are doing incredibly well compared to other states. This is a map based on public data that shows how we're doing with regard to social distancing. And we are really taking this seriously, and the vast majority of people in our state are doing their part. And so I want to thank you. I know it's not been easy. I know that it's been difficult for folks in our state, but we are getting through this, and we're going to get through it together. So thank you for doing your part. We do have some good news when it comes to testing. We are testing more people every single day. The number of new cases we see is starting to go down as a percentage of that as well. And this is great news. We've got a lot more work to do on this front. We could do twice as much testing as we are currently doing. And so knowing that we've got that capacity is heartening. Making sure that we've got the supplies we need to actually execute is our challenge. Starting today, all of the new testing sites that I mentioned on Monday are open and ready to test people. Walmart in Southgate is and now doing business as a testing site. Walgreens has opened a new Detroit site. CVS has opened a Dearborn site. And I want to especially thank Congresswoman Debbie Dingell for her help and commitment to expanding testing for our citizens in Dearborn. And Rite Aid has sites open in Macomb, Swartz Creek, Eaton Rapids, Kentwood, and Saginaw. I encourage you to please go to michigan.gov/coronavirus test to find a testing site near you. We want more people to get tested. While we had to prioritize who was tested in the early phases, now we want to make sure that we are getting more people tested in Michigan. Testing is the only way that we will know where the virus is so that we can appropriately deploy our resources to slow the spread. If you have symptoms and believe you came in contact with someone who tested positive, find your nearest testing site and get tested. COVID-19 symptoms include fever, cough, and shortness of breath. If you have any of these symptoms, call your healthcare provider or visit michigan.gov/coronavirus test to contact a testing site near you. If you are an essential worker reporting to work in person, whether you have symptoms or not, please get tested. Call your healthcare provider or visit I know I sound repetitive, but I'm doing that for a reason. Michigan.gov/coronavirus test to contact a testing site near you. You don't need a prescription to get tested. You don't need a healthcare provider to refer you. Supplies to run those tests are still a constraint, yes, all over the country, and we are working to ensure that those labs and healthcare providers have sufficient supplies and staff support to support this testing effort. We will also continue to need some help from the federal government to ensure we have and maintain and continue to have robust testing in place. I'd like to give you an update on PPE, that's the personal protection equipment. A couple of weeks ago, we had less than a day's worth of PPE in our hospitals. Now, with the help of both large and small businesses in Michigan, with the help of the federal government and the help of our procurement office, we have secured enough PPE to last hospitals over a week, even several weeks in some cases. Dozens of businesses have stepped up, and we're really grateful. Businesses like Stormy Cromer in the Upper Peninsula, who produces those phenomenal hats. They're making masks. Carhartt, who the world knows Carhartt, they are making gowns. The big three automakers and the UAW members making ventilators and face shields. And Grand River Brewery, TC Whiskey, Mammoth Distillery, Bell's Brewery, all of whom are helping us produce more hand sanitizer. This has been an all-hands-on-deck effort, and it's working. We are rising to this challenge together. We are still anticipating more deliveries of PPE and will continue working until every hospital in Michigan has the supplies they need. I want to thank our hospitals and our healthcare workers for doing your best to use PPE efficiently and safely. We appreciate it, and it has helped us get into this position where we are definitely stronger today than we were a couple of weeks ago. With regard to hospitalizations, the number of patients who are in the hospital with suspected or confirmed COVID-19 has declined from a high point of about 10 days ago. In fact, we have seen a 15% reduction in the last 10 days. Michigan is no longer in the top 5 states when it comes to positive cases. We've dropped down behind other states, and it's because our aggressive actions and measures are working. States without stay-at-home orders have seen an increase in cases recently, while our data shows that our order is working. But we are still in the top 10, and we are still in the top 5 in terms of number of deaths. So this shows that what we are doing is working, but that we must keep staying safe if we're going to keep dropping our numbers and saving lives. I showed a similar graph on Monday to where we are versus where we could have been. And here's where we are now versus where we would be if we hadn't taken aggressive action to fight this virus. This shows that the people are doing their part and making an impact. You're the reason that we have enough PPE for our first responders. You're the reason that our hospitalization rate is decreasing. And in the end, you'll be the reason that we can safely begin to phase back into our new normal. I want to especially highlight the hard work of our brothers and sisters in labor throughout what they have done throughout this crisis. I've been able to speak with a number of our dedicated union members over the phone, and I know the hard work you're putting in on our behalf. I want to thank the Teamsters for making delivery of crucial PPE and supplies for our healthcare workers, first responders, and families. I want to thank the UAW for helping build face shields, ventilators, and more. I want to thank the building trades for working on our alternate care facilities at Suburban Showplace and TCF, and for working on roads projects during this crisis to keep our roads safe for drivers and first responders. I want to thank the MEA and the AFT members for helping educate our students from a distance, over Zoom, over the phone, through the mail. I want to thank the UFCW workers who are making sure the shelves are stocked at our grocery stores and helping Michiganders put food on the table. I want to thank the AFSCME and MNA, the Michigan Nurses Association, for providing critical healthcare and janitorial services to protect our families. I want to thank our SEIU members in the healthcare profession and in the Department of Corrections and those working around the clock to process unemployment claims. I want to thank the frontline workers from the Michigan Professional Firefighters Union, the Michigan Association of Police, and all of our incredible first responders who are working to keep our families safe, and the laborers working with the Air National Guard and servicing vehicles to keep up the supply chain, the operators, and the list goes on. Working people built this state, and I am proud to have them in our corner, protecting families and helping us heal. Today, I've outlined several things that Michigan is doing in our battle against COVID-19. Like I've said, there are reasons for cautious optimism. We need to keep it up. I'm hoping to say more when we can start loosening restrictions as soon as Friday of this week. I'll continue this conversation and share more information. I want to be clear, we will likely need another short-term extension of the stay home, stay safe order. When we do start to re-engage, it will have to be very thoughtful and precise, mitigating risk to all and mitigating the risk of a second wave. But we will start to re-engage. We will have a plan, and we will start to share that in more depth as we get closer to next week. Michiganders will still need to stay home unless they're doing things that are explicitly permitted by the order. We've got to get this right. That's the most important thing. As I've talked to business leaders, as I've talked to families, as I've talked to those who've lost a loved one to COVID-19, we all recognize, even if we might disagree on the cadence and the timeline, we all recognize that a second wave would be devastating to our state, to our people, and to our economy. We've seen proof that loosening restrictions too fast can lead to a second peak. It happened during the flu pandemic of 1918, and it's happening in some countries around the world today. As hard as this is right now, a second wave would be devastating. So when I say I'm hoping to loosen some restrictions, I mean that I'll only loosen them based on what the facts and data are telling us when it is safe and how it is safe to do so. I'll continue to work with the best experts like the ones we have here today from the University of Michigan and Dr. Khaldun and our epidemiologists to make sure that we get this right. But again, the data we've seen in the past week has led me to believe that it's time to reevaluate the stay home, stay safe order. Now, as I want to speak directly to the state employees who serve our state every single day. They have hard jobs and they show up and they serve the public. They have a special place in my heart. I've had the privilege of serving with the thousands of state employees and serving them as I was a legislator. And I'm proud to serve alongside our state employees now as the governor and as we navigate this crisis. I know that you are a crucial part of this team, and you've all done your part to help protect families in the wake of COVID-19. In the past 6 weeks, we have faced an unprecedented challenge that has led to serious budget implications for our state. In order to ensure that the essential services that we provide every day to the people of Michigan continue, I've made the difficult choice to approve a temporary layoffs in departments across state government. Employees who have been laid off will retain their health insurance and other benefits and will be automatically enrolled into the unemployment process to help ensure that they have the support they need during this challenging time. These layoffs will last for 10 work days, and I've mentioned that I've made a lot of hard choices in the past 6 weeks. This was one of the hardest. But this is the right thing to do to ensure that we can continue providing critical services to the people of Michigan. I know how important it is for our leaders to lead by example, which is why this week I announced that I would be taking a pay cut and have directed my executive team to take one as well for the remainder of the fiscal year. The actions we've taken in the past 6 weeks are working. Because of the hard work of our state employees, we're seeing the curve start to flatten, and we're saving lives. So to my fellow state employees, I'm proud to serve the state of Michigan alongside each of you every day. I'm honored to be amongst your ranks, and I'm going to do everything I can to make sure you get the support you need through this challenging time. In the coming days, I will share this podium with leaders in business and labor to discuss plans to phase in sectors of our economy. I'll continue working with a bipartisan group of Midwestern governors to make sure that we get this right and avoid a second wave like we've seen in other countries around the world. You'll hear more on this in the coming week, And today you'll hear from two experts from the University of Michigan who've been helping me ensure that we take a fact-based approach to fighting this virus and saving lives. But first, I'm going to pass it off to my partner, Dr. Janae Caldoun, our Chief Medical Executive.
Thank you, Governor. Today we announced 33,966 cases and 2,813 deaths. We are still proactively fighting this disease using the best public health tools that we have. By far, as you all know, social distancing is the most important thing we can do to stop the spread of this disease. This means people not coming out of the house unless they absolutely have to, for food, for medicine, or to do critical infrastructure work. And it is working. We're seeing a slowing in the rate of rise in new cases. Our hospitals, who felt the biggest burden and surge, are now leveling off, discharging more COVID-19 patients than they are admitting. There are fewer people in intensive care in our hospitals. And as I've said before, different parts of the state may see cases of COVID-19 rise at different times. So we are not yet out of the woods. We're closely monitoring the entire state, making sure we're ready for any surge in cases and preparing to especially support our hospitals, particularly the ones in rural areas, so they have the capacity to be able to care for people if they need to. We've also heard that some people are not seeking care for very important medical concerns, such as severe chest pain or difficulty breathing, or delaying diagnostic and treatment procedures for cancer. It is really important that everyone knows that they should still seek care if they need it. If you think you are having a medical emergency, please do not delay seeking treatment. Testing and treatment for things like advanced heart disease and cancer should still move forward. Please, again, don't wait for treatment, and talk to your doctor about how you can get testing and treatment in the safest way possible. We've also focused a lot on expanding access to testing, again, a very important part of our public health strategy. We've now announced over 21 new cases over the past 2 weeks, and we continue to see a rise in the number of tests that are done. As the governor mentioned, we've also expanded our testing criteria. So right now, anyone who has symptoms can get a test, and anyone who is a healthcare worker, a first responder, or needing to come out of their home to do any work right now during this crisis can get a test done at a testing site that has the supplies. We're encouraging everyone who should get a test to get one. Again, I'll say it, you can go to our website, www.michigan.gov/coronavirus test, to find the site nearest you. We also know that we have to protect our most vulnerable, and especially those who are elderly or living in our nursing facilities across the state. On Monday, we announced that skilled nursing facilities are required now to report any case of COVID-19 to the Michigan Department of Health and Human Services. We are analyzing and collecting that data right now, and we expect to be able to share that information with the public on our website in the upcoming days. On Monday, we also announced the creation of new teams that will work with local health department staff, epidemiologists, and clinicians who will work closely with long-term care facilities, nursing facilities, to make sure they are following the best infection prevention protocols and also testing residents appropriately for the disease. I'm pleased to announce that we are able to provide a total of $3.8 million to our local health departments all across the state to be able to do this important work. Again, we are all doing the right things. We're seeing a slowing in cases, testing is increasing, and people are recovering from this disease. We can beat this virus. Life is not going to go back to exactly the way it was before for a while, and we will have to be patient and also cautious. But I encourage everyone to stay the course. We can do this together. With that, I'll turn it over to Dr. Eisenberg and Dr. Martin.
Thank you for having me. So I'd like to start briefly by introducing myself. So as the governor mentioned, I'm an associate professor of epidemiology, complex systems, and math at the School of Public Health at the University of Michigan. And I'm here with my colleague, Dr. Martin, who's an associate professor of epidemiology, also at the School of Public Health at the University of Michigan. Our modeling team is a combination of researchers in public health, medicine, math, and other folks, other departments. I wanted to talk with you all a little bit about some of the modeling that we've been working on, looking at different potential scenarios for resurgence if social distancing is lifted. And so we've developed this model based on both regional and statewide data from Michigan to help with forecasting and to help with planning and scenarios. And so I just wanted to start a little bit first by just saying that all models have their assumptions and limitations, and models are very useful tools for reasoning and planning, but they aren't crystal balls, right? So I just want to note and sort of acknowledge at the forefront that there's a lot of uncertainty that goes into these models, both in the data and in the sort of parameters and how they're built. So I just wanted to sort of mention that briefly. With that, I wanted to show a couple of things. So here's some hypothetical scenario where social distancing is lifted over a 2-week period starting May 1st. And in this scenario, social distancing is lifted completely by the time that 2-week period is finished. And so what you can see here is that there are a wide range of outcomes, right? So going from a very small or even no resurgence all the way up to quite a large second peak or resurgence in transmission. So while we can't say from the model which of this sort of shaded range here of scenarios might happen, it just means that a resurgence or a second peak is a real possibility that we need to consider if social distancing is lifted. And this range of outcomes really comes from the fact that there's a lot of uncertainty right now in terms of the proportion of the population that is susceptible or immune to the disease. And so that ends up meaning that a wide range of potential scenarios for a second peak are consistent with the data that we've seen so far. And so it's also important to note for these simulations that while I showed a moment ago, I showed the graphic for all of Michigan, if you sort of run the model for different regional areas, you get a lot of different potential second peaks or resurgences that you can see region by region. And so in Southeast Michigan, for example, in places that have seen more cases, we have more data. It lets us do a little bit better at sort of restricting the range of what could happen. But in areas that have not seen as many cases so far, where the epidemic started later and may still even be increasing, we have less data. And because of that, it ends up meaning that the range of potential second peaks, is wider. And so that's just something to be aware of, and it just means that those regions may need more monitoring, because there's a lot of uncertainty in terms of what could happen. The other thing I want to note about these simulations is that we're running the model in this case where you relax social distancing entirely and you leave it off. So that means that the simulations that we're just showing, those second peaks are in the circumstance where you don't intervene further. So of course, in reality, if you started to see something like that, people would take action and intervene. So I'm not saying that that's what we would actually see. It's just that that's what the model projects forward if you were to release social distancing and let it go, essentially. So that's sort of just one thing to note. The other piece to note is that, of course, as we move forward and get more data, and as testing continues to ramp up, we'll have more information and we'll be better able to see what scenario we're in. And so as that happens and as re-engagement starts, those projections will tighten. All of this is just really to sort of underscore the point that it's really important to think about staged re-engagement and to do careful monitoring so that we can track and handle any increases in epidemic spread that might happen. So that brings me to sort of the last point, which is about the kinds of indicators that will be important to monitor as we start to think about re-engagement. And so there's sort of three classes, broadly speaking, of types of data and indicators that we'll want to keep track of. So the first here, sorry if I'm interfering, hopefully not. The first here are the epidemic spread indicators. So these are things like symptom monitoring, cases, deaths, and really trying to get a regional picture of transmission, because different parts of the state have different, epidemic patterns going on. And the second here is healthcare system capacity. So this is really sort of emphasizing that it's if you are to have a resurgence in transmission, then it becomes really important to make sure that you have the healthcare system capacity in place to handle that and be able to diagnose and treat patients. And so this is really all about personnel, beds, ventilators, personal protective equipment, those kinds of things. And the last one, which is really critical, is public health capacity. So this is making sure that we have both the testing capacity and the contact tracing capacity to be able to actually detect resurgence in epidemic spread if it should happen. So that, I think, is everything I sort of wanted to talk about. I'll pass it back. Thank you.
Thanks, Dr. Eisenberg. Stay right there. All right. Well, thank you. I appreciate it. And Dr. Martin, thank you for both being here. I think that it's important to have the opportunity for you, my friends in the press, to ask some questions if you want of the epidemiologists as well as me or Dr. Caldoun. So with that, I'm happy to open it up.
Governor Whitmer, yesterday you canceled the contract for contact tracing. Do you know who made that decision to contract with those companies, and how do you expect to restore public trust in contact tracing considering that?
Yeah, so contact tracing is a critical component to ensuring that we understand where spread is, that we isolate the appropriate people so that we avoid a second wave. And I know that Dr. Eisenberg just kind of highlighted that. The effort to go forward with contact tracing is something that we take very seriously. Now, with regard to this contract that you asked, I'm glad you asked the question. The department thought that that vendor was the best one for some reason. I don't know what that reason was. But I do know that the Department of Health and Human Services does not have a political bone in their theoretical body. They moved forward with the vendor, but they should have gone through the SEOC, the State Emergency Operations Center, which is the clearinghouse for all of this work. When it was brought to my attention, I told them to cancel it. This was an unnecessary distraction, and I think that leadership is about solving problems. The correct process was not followed. We are fixing it because it's important that we get this right, because this work is incredibly important. So this is an essential part of how we're going to save lives and start to reboot our economy. I made that decision. We are moving forward, and I think that the appropriate people understand the flaw, and that will not be repeated.
Governor, you mentioned we'll likely need a short-term extension of the stay-at-home order. Do you have a window of dates that you're looking at for that short-term extension, and will it be statewide or will it be based on regions?
So what we know is that we are going to have to look at the process of re-engaging sectors of our economy as the Trump administration likes to call them phases. Some people refer to them as stages. I like the thought of waves. I don't know, maybe it's the water. Everything is about water here in Michigan, right? The Great Lakes. Regardless, it's not all going to happen overnight. And so we know that there will be a need for an extension of some sort. We know that even when we get to a stable moment, that people who are compromised, who are vulnerable to COVID-19, are still going to need to stay home. And so some version will be in effect for a while. What we know right now is that we are seeing a trend where our numbers look pretty good. We know that we still need to do more robust testing. And once we get our hands on swabs and reagents, we can double, maybe even triple the amount of tests that we're conducting in Michigan, and that will be absolutely essential. But we see these signs and know that perhaps we can start to take some small steps forward. I'll articulate that a little bit with a little more clarity when we return on Friday for the briefing. But I think that now is an appropriate time to reassess the breadth of the current stay-at-home order, to assess the scope of what the next one might look like. I'm as eager as anyone to start re-engaging sectors of our economy, but we all know we've got to be really smart about what that looks like, and so it will be in waves. There will be some form of a stay-at-home order in effect for a long time here, and I know when I say that, everyone's going to speculate, what does that mean? What it simply means is that for the near future, we know that it's not going to be safe for especially vulnerable population to be out and about publicly, and so people who have COPD, people who are over the age of 65, are going to have to continue to stay at home. The vast majority of people will for a short time being, but we will start to loosen that up as days get closer and as time goes and as our testing ramps up.
Governor, we know that the chat feature on the unemployment website is down for the rest of the week. People have had issues getting through, making phone calls, getting online. Today you mentioned that the state employees will be automatically enrolled in the unemployment system. Is that fair for the people who have been waiting 4 weeks without a paycheck? And what do you say to those people who still can't get through?
Yeah, thanks for asking the question, Mackenzie. It doesn't mean that they jump the queue. It just means that they won't have to go out of their way to sign up. We're asking a sacrifice of our state employees, and so we wanted to take that as one stressor off of their plate as they're trying to figure out kind of next steps with our this action that we had to take now. With regard to unemployment, I can update you that around $825 million in payments have gone out to more than 800,000 claimants that have been affected by COVID-19, and those numbers are continuing to increase every single day. We've gotten over 1 million unemployment claims since March 15th, which is a quarter of our state workforce and nearly 5,000% increase over that 4-week period. So more than 90% of people are filing more than 90% of people filing online. It only takes about 25 minutes to do so. We're encouraging people to continue doing that, and as we navigate our next steps, my message to everyone is that we continue to navigate the process. You will get paid what is due, what you have earned in unemployment, and you won't get penalized for lateness, and we will continue to ramp up our efforts. We've made great strides, but it's not perfect, and the department is working toward getting there, because that's anything less means that you got work to do. We recognize that.
Automakers have expressed some desire to get up to 25% capacity by May 4th. Have executives from those companies come to you to ask for that, and are you open to that possibility?
So I've been talking with the heads of the big three. I've been talking to suppliers. I've been talking with the head of the UAW. I had a conversation with each of the CEOs of the big three just today. I talked with the head of the UAW today. I know that there are a lot of pieces to the discussion that they are having, but I am monitoring it to know what their protocols are. The economic recovery group that is helping to advise my work, that is also being scored by the University of Michigan for risk, is watching very closely as well. And I understand that they've got some issues to work through, and at the appropriate time, I am hopeful that we can analyze what the protocols are and start to slowly re-engage in a safe manner. But I am very close to the conversations that are being had, and we're taking it very seriously and trying to make sure that workers will be safe if and when certain parts of the business starts to re-engage.
Governor, you've said many times that this virus doesn't observe county lines, but you've also talked about a regional reopening approach. How do you reconcile those statements? And given the data at this time, do you have regions that are contenders for eventual reopening?
I think we can't make the assumption that just because part of our state hadn't seen COVID-19 when it was really growing so exponentially in Detroit, that it meant that those parts of the state were immune and not going to confront it. We know that, as I work with my colleagues from Wisconsin and Indiana and Ohio, our border states, that we have to understand what their thought process is to make sure that we're sharing data so we're all smarter as we're making these decisions. And we also recognize that we are watching trends as they play out regionally across the state of Michigan. A few of the slides that I showed on Monday showed that the southeast Michigan part of our state has really started to cool down, and yet there are places in rural Michigan that are heating up that we are watching very closely. What we know about, for instance, if we're looking at Alpena or Muskegon or Kent County, which is not rural Michigan, but it's the west side of the state, and it hasn't been as concerning as southeast Michigan, is that while they've got plans and we are working closely with them, as this virus continues to spread, not each of those other places are as well equipped as Kent County is if a COVID-19 spike starts to happen. And that's why we've got to watch very closely. And so as we determine and we associate risk with various sectors of our economy, we also associate geography as a part of that risk analysis. And so that is one part of the determination about where we need to mitigate risk and where we need to be mindful about the sequencing of different sectors of our economy starting to re-engage. Wow, any questions for the epidemiologist?
I don't know if they'll know the answer to budget questions. But going back to the layoffs quickly, how confident are you that there won't be more layoffs coming for state employees? And the budget shortfall is estimated to be $2.5 billion. The layoffs right now, about $5 million that'll save. Is that enough, or what else can the state do? And are you confident that we'll get enough money from the federal government to help offset some of this?
Well, here's what I know. This crisis has taken an economic toll on household budgets, on local government budgets, on the state budget, on business budgets. We are all going to have to navigate this to the best of our ability and to protect as many people in the process. The Federal CARES Act dollars have got a lot of restrictions, and so they don't help meet the needs of a lot of the issues that we are going to feel in terms of the state budget. That being said, I'm continuing to work with our bipartisan congressional delegation to ensure that the next supplemental, and they're already talking about another one, recognizes the incredible strain on state budgets and gives us the flexibility we need to really make sure that we shore up the core functions of state government. I think about our children who will be going, hopefully, back to school in the fall in a traditional sense, and who will need wraparound supports to make up for the challenges that they've confronted as a result of COVID-19. We need to have the flexibility to do right by them and their teachers and all the educators in our schools. And so what happens on the federal budget is absolutely going to have an impact on the budget issues that we have in the current fiscal year, which ends in September, or the next budget year that begins then. And so we're going to have to make some tough decisions. Obviously, these layoffs don't fix the problem, but it is, I think, important to show that we are serious about tightening our belts where we can in a way that doesn't meaningfully undermine the critical work that we still have to do in this moment.
Governor, returning to the contact tracing contract, securing like a new vendor for that, how much is that going to delay those efforts, and considering the importance that your administration has placed on that tool in particular?
Yeah, well, considering the importance that every administration in the nation is placing on contact tracing, it's really important to our ability to mitigate the potential second wave and to protect lives. So the SEOC will make an announcement when a contract has been awarded. They are moving post-haste. This was something that came to my attention recently. I took the action, and now we are moving forward quickly to try to make sure that we've got a vendor that can do the job, do it well, and to ramp up quickly.
Do you know how much data that other contractor had access to prior to the termination of that contract?
Beth, we'll have to follow up with you on that. I don't believe that much had even gotten started at all, frankly. I'm glad that it came to my attention as early as it did. As I said, the department, they're not political. They are looking at making a judgment based on what outfit they thought could do the job well. But I know that it's important to take out any speculation, any concern, and I think that it was appropriate to cancel it, which is what I did, and we're going to move forward, and the SEOC is the appropriate place to make the determination, and they will be making an announcement soon, I'm sure.
A question for the epidemiologist and Dr. J.
All right.
What level, the governor mentioned on Monday that we had the capacity to do over 11,000 tests, but we're limited based on the number of reagents and swabs available. What level of testing realistically do we need to be at to start considering these waves of reopening?
Right, so I'll start, and certainly Dr. Eisenberg can come back as well. So we think, based on talking to experts across the country, that we need to get to at least about 15,000 tests in the state to be able to really get a good understanding of who has the disease so we can guide our public health response. There's a lot of reasons, and we're thinking through those as far as why we're not at that capacity. Again, reagents, swabs, but also we've increased testing significantly even in the past week, and part of that has been expanding our criteria so we're not as stringent as we really had to be early on. People with mild symptoms or people who don't have any symptoms at all, healthcare workers, frontline workers. So we're hopeful. We think we'll be able to expand our capacity as quickly as possible.
We've heard that we're going to start to see more data reported from nursing homes and facilities across the state. When specifically will we see that information? And how is the state providing any sort of guidance on PPE for those employees and the people in the facilities, as well as keeping the patients that are currently healthy and separate?
Absolutely. So you're absolutely right. There's a couple things that are incredibly important to this response. One is protecting our most vulnerable, obviously, so people in nursing homes. And it's also been wanting to be as transparent as possible with the data. And I'll be the first one to tell you, our systems, our public health data systems, are outdated. They haven't been funded, and this is just not here. This is across the entire country. So oftentimes we want to do something, but the system just doesn't allow us to do it as quickly and as robustly as we want to. So we expect to be able to, again, we're looking at the data now. We're hoping by next week we'll have accurate data. I don't want to put out anything that's wrong, right, and penalizing, potential facilities that don't have any cases. So we're working through that, and we expect to be able to do that next week. As far as making sure our nursing facilities are doing the right thing, that's the whole concept behind the strike team. So the ones that are going to be supporting the great work that our local health departments are already doing, quite frankly, bringing in more capacity. We helped the city of Detroit get an epidemiology aid from the Centers for Disease Control to be able to do that. But we'll continue to work to expand capacity and make sure these nursing facilities have the support that they need.
Quick follow-up to that. Will we see the names of the facilities released from the state that have COVID-19 confirmed cases when we get that information?
That is our goal.
And then looking at just reporting information daily as a whole, some of the numbers are fluctuating as time goes on. When is that a transparency issue? Can people trust the information that the state is putting out each day?
So, great question. Again, a lot of these systems, some people are putting things in automatically, so it's automatically fed to us, and others are literally doing it manually. We figured out also there are some labs that wait to send us tests, and they don't maybe have workers on the weekend, so they don't send us anything over the weekend, and all of a sudden we have an increase on a Monday. So those are the types of things that we're working out. But again, we want to be transparent. And again, things may fluctuate and data may change, but we want to at least get the data out that we can as quickly as we can.